Kingdom. Hey guys, Dr. Ben Gallagher here. Put down below where you guys are watching from. Love to give you a shout out all over the United States, over the United Kingdom. Holly, how are things in the United Kingdom this year? Let me know. How's health over there? And then we also have Rose Mansell from the United Kingdom as well. So couple Brits on here. Good to see you guys. Ask any questions at all regarding health. We work at FA Well Centers. We work with Hashimoto's. We work with gut issues. We work with other types of thyroid, brain issues. Hi there from Romania. We got a bunch of Europeans coming in. So great to see you guys. Again, pop down below where you guys are watching them and any questions at all. It is grim, it is cloudy and rainy. Yeah, I'm here in Colorado and we have snow on the ground, which is great. We need snow. That gives us everything we can. Okay, there we go. Can you help with Graves' disease? We've got the first question coming in, guys. And here's the deal. I usually get hundreds of questions on these live Q&As, so if you want your question answered, put it down below quickly and I will get to that. So Graves' disease, autoimmune condition, it's where it causes the thyroid to go into hyperdrive. Hey Jerry, good to see you. Syracuse, New York, Deborah, good to see you. And then Victoria in Michigan. So Graves' disease turns into this hyperthyroid situation. So Hashimoto's is usually hypo, Graves is hyper. A lot of people with hypothyroid are like, man, I wish I could have hyperthyroid because you can't gain weight. You're kind of, but then you're anxious, your heart's racing, all these things. Unfortunately, Graves' disease can be deadly. Hashimoto's is not, but Graves' disease can, so you do need to take some action with that one and see what is going on. But here's the thing, Graves' disease, same thought process as any other autoimmune condition out there. Adrenals, blood sugar. Hi Diane, we'll get to that one. The adrenals, blood sugar, vitamin D up at 80, leaky gut, the infections, environmental toxins, estrogenic events, all these different things. So yes, you can have help with Graves' disease. I've had patients that have been able to hold on to their thyroid and did not have to remove their thyroid. So Holly, I suffer from anxiety as well. I'm convinced it's my low ferritin level of 19. So the brain needs two things, guys. Write this down, and I really encourage you, anytime I go live, anytime we do a QA, have a notebook and write down, because I'm going to be giving you tons of tidbits. You're going to forget a lot of these things. So the brain needs two things. It needs oxygen and it needs glucose. So yes, the brain, if you're having anxiety attacks, look to those two things. Anemia, if your ferritin is in the teens, 20s, if it's under 40, you have some type of anemia, a low iron state, and you're not going to be transporting your oxygen to your brain like you need to. The other thing you need to look at is, especially if it's random anxiety, is that blood sugar is crashing down, and then it's going to be stimulating this adrenaline to go through the body, because the adrenals tell the liver to kick out glucose, and so then it gets revved up through there. So yeah, you've got to get that blood sugar as stabilized as possible, and you've got to figure out why you have ferritin issues and low iron issues in the first place. So what do you need to do? Look into leaky gut, malabsorption, bad bacteria in the gut, a lot of those different things. So again, welcome guys, Dr. Ben Gallagher, FA Well Centers. We've got offices in Colorado, we've got offices in Tennessee, and we work with patients all over the country, all over the world. If you've got issues, if you need help, click the link in any of we've got different links set up on TikTok, Facebook, YouTube, all over. Click that one, schedule the discovery call. Best way to get a hold of us and talk about what you have going on. So Patricia, hello from Montana. Any ideas on how to deal with chronic gastritis? I was told to use Prilosec. Patricia, okay, here, write these three things down, guys. This is my super duper tidbit for helping your digestion, especially gastritis. That's going to be more of a stomach issue, and Prilosec is designed to decrease stomach acid production. So here's my guarantee, Patricia, if you do these things exactly like I tell you, do them exactly like you need to, the next 7 days, if you still are having gastritis and it's still there and it's not improved dramatically, send me a message next week, and I'll send you one of my books free. Rebuild Your Brain, Stop the Damage, Start the Repair, or my blood sugar book, Blood Sugar Doesn't Lie. You can get both of those Hashimoto's on Amazon, I'll give you one for free. So do all three of these things, and if it doesn't make a major difference, let me know, and we can get you that book. So number one, you need to eat in a relaxed environment, and as you're doing that, you need to chew 30 times per bite. So you're chewing 30 times per bite in that relaxed environment. And yes, you're going to be sitting there. Hey, Robin in Tennessee, good to see you. You're going to be sitting there for a while, but yeah, you definitely need to make sure that you are chewing 30 times per bite. You're going to annoy your neighbor, your wife, your spouse, whoever it is, but you need to chew like that. Number two is you're going to not drink fluids with your meals. So do not drink fluids with your meals. You can have a sip or two, but that is it. No water, no iced tea, no sweet tea, no sodas, no wine, whatever it is, maybe a sip or two, but no fluids with your meals, otherwise you're diluting your stomach acid. And then number three, you need to properly combine your foods. So you need to keep your proteins and your starches separate. Give me some hearts, give me some likes, thumbs up, if you guys have tried any of these tips, or if you're one of my patients and you've done this stuff, it is huge. So keep your proteins and your starches separate, and that can make a major difference. So that will definitely be helpful in there. Do those things, let me know, and if it's not better, I will send you one of my books. All right. Why do I have heat intolerance? Can that be fixed? Didn't it get bad until thyroid removal? So obviously there's some type of a metabolism issue going on here, and maybe you're on too much thyroid medication. I would look to see if you're in a hyper place. If you're in hyper, it definitely can cause some of that heat. So again, live Q&A, ask any questions you've got down below, and we'd love to answer those. Derek, good to see you. I'd love to hear your summary on H. pylori and your protocol. Yes, I'm about a few weeks into the supplements you suggested. I've researched it, but I need to step up my diet for the second remaining weeks. Yeah. So hey Derek, good to see you. H. pylori. H. pylori is a bacteria. It's the most common bacteria infection actually in the world, and it really hits the digestive tract. It's going to be causing ulcers, which is going to be a big part of why we get burning and irritation and things like that. But here's the deal: 80% of H. pylori actually is in the small intestine. And what that's going to do is it's going to cause leaky gut. It's going to cause irritated lining in there, which can lead to autoimmune conditions, psoriasis, eczema, all types of different things. So yeah, with H. pylori, we've got to do kill off. And it's going to take at least 30 days to do that kill off for that H. pylori. If you have a spouse and you guys kiss at all, there's a very good chance that you both have H. pylori, and that's going to go back and forth. So you've got to be able to even treat your partner as well if they've ever had H. pylori or have any symptoms in there also. So you probably both need to be doing some support, and there are natural things that are going to be helpful for that H. pylori. Garlic, wormwood, a lot of different nutrients that are good that way. But if you're having any type of digestive disturbance, any type of gut issue, leaky gut, any bacterial infection, anything like that, then you need to look into H. pylori. What you look for in the blood work would be white blood cell count low, and then you also look at your neutrophils over 58%. So again, pop down any health questions at all. Would love to answer any questions you have, whether that's in regards to thyroid or autoimmune or gut or anything else on here. Go ahead and do those. So yeah, Derek, you've got to get through that. Then once you're done killing off, bring in the good bacteria, and that's going to make a huge difference. And then some of those dietary changes, just really anti-inflammatory diet at that point as well. Let's see, how do you get rid of anxiety? I got it from the coronavirus. I've been cooped up in my house. This is Boston 337. I've had multiple patients that have gotten anxiety after getting COVID. Yes, there's the the emotional side of just dealing with being locked down and all that stuff, wearing masks and all these things. And yet a lot of people, after having COVID, the virus itself, they started developing anxiety. Big thing we're looking at here is with that anxiety, one of the first things you need to look at is getting a brain map done. You need to do a brain map, and then you need to do what's called neurofeedback. And if you're local to the Colorado or Tennessee offices, or if you can get a brain map done, even if you can't do neurofeedback in office, we can send a home unit out to you wherever you are. If you're in Boston, I would imagine there's some people out there. I really don't know, but reach out and we can talk to you about this. But I've seen it, even high blood pressure. I had a patient, he's 35, and his blood pressure was like 210 over 120. And what happened was the first night we did neurofeedback on him, it went down to, it was like 150 over 90 after that first night. And then over time, it just gradually went down as we were able to calm that brain down. Hey, Susan, good to see you there in Michigan. Robin, how long should it take to stabilize blood sugar numbers? If you're using a continuous glucose monitor, like every one of our patients uses a continuous glucose monitor, if you're using one of those, it's anywhere from 4 to 8 weeks is really what it takes for people to get a great idea of what is making that blood sugar go up and what's making it go down. If you're using a finger prick glucose monitor, it may take a little bit longer just because you're having to do it less frequently. You're not getting as many data points, etc. So yeah, let me know, Robin, is it taking longer than that for you? How do I lower blood pressure for good naturally? So this is a TikTok user. So here's the deal. The number one reason why I see blood pressure go up is actually high blood sugar. And so blood sugar, prediabetes, insulin resistance, all these things are going to contribute to that blood pressure going up. So first thing you need to do is start monitoring your blood sugar. Just like in my book, Blood Sugar Doesn't Lie, I explain in detail how to do that, either a finger prick glucose monitor or you use a continuous glucose monitor like we do with all of our patients, and you get the data points and you know so much of what you need to be doing at that point. But blood pressure, high blood pressure, usually a blood sugar component. Susan, I have a medication causing so much problems. Doctor refuses to let me wean off. Nerve pain out of the roof, can't sleep or nap. So Susan, here's the deal. It's your body. And I don't care what the doctor says, you have the ultimate say. And if you're miserable, you have to take into consideration the side effects of not being on the medication or the side effects of being on the medication, and then make that decision yourself. But there's no doctor that can make you start doing that. If you don't know how to wean off of it, then you might have to get into support groups. You might have to do a bunch of Google searching, things like that. If your doctor will not help you wean off that, you might need to look up how to do it yourself. But I mean, that's pretty crazy that your doctor won't let you do something for your body. I mean, give me a thumbs down or a unhappy face if any of you guys don't agree with that. Opinion on hemorrhoids, Harry. So hemorrhoids, this is where that blood vessel kind of hangs down out of the anus. You can get bleeding. It can be painful, not much fun. But there's a couple things that can contribute to that. One of the first ones is that it can be the adrenal glands. You can have some adrenal deficiency, and the adrenals, they give tone to our blood vessels. So if you're having a bunch of varicose veins, if you're going from a squatting to a standing position and you get dizzy, that is usually an adrenal issue. So you've got to be able to make sure those adrenals are working as well as they should. If not, that vein can kind of sink out of the anus there, and then you can have that hemorrhoid. So look into the adrenals. That's a huge part of it. Some of the obvious ones: don't sit on the toilet too long. You can actually get a lower toilet, or get they call where you get your feet up a little bit higher when you are sitting on the toilet. But a lot of people, they've got their toilets really, really high and they just barely sit down on there and then sit for a while, and that's going to cause it to open. The other thing you can do is actually squatting, and where you just squat down, put your butt down onto your heels and sit there for 2, 3, 4 minutes and do that multiple times a day. And that can start actually strengthening your pelvic floor muscles. So for any of you women out there that are having any pelvic floor issues, actually full blown, where you guys can't see me, but I'm basically, full squatting down and giving my pelvic floor a chance to actually work in that position. The number of women in Asia that have urinary incontinence, things like that, is pretty low because they squat and they sit like that a lot of times. So let's go here. And all right, Nellie just happened on now, and only hear a little bit about H. pylori. I suspect I have it. My doctor scheduled me for an upper GI test where they insert the camera to look inside. Can't remember the name right now. Is there another way to find out if you have it, and what can I do to naturally eliminate it? Yeah, Nellie. So here's the deal. Again, let's recap H. pylori. What you want to look for in the blood work is definitely neutrophils being over 58%, and then potentially even the white blood cell count is low. And so that's going to be a cause of a bunch of symptoms. If you do have H. pylori, you're going to have burning, you're going to have potentially reflux, indigestion. It's going to be just uncomfortable, bloating, a lot of different things. But if you have leaky gut, there's also a good chance that you have H. pylori, because 80% of H. pylori is actually in the small intestine. So I would look at some of those markers, Nellie, and then yes, Brittany, if you want to put the intestinal protect from the Well Store down there for Nellie, you would do this 4 per day, 2 twice a day, and you would do that for 1 month. And it's a pretty intense regimen, but if you have it, you got to kill it off, and then you come back in with the good bacteria as well. So again, Dr. Ben Galliard, F8 Well Centers. We have offices all over the country, Colorado, Tennessee. We work with patients remotely. If you need help, if you need support, put a question down below and I will get to it as soon as I can. If I do not get to one of your questions, send me an email, drben@f8wellcenters.com, drben@f8wellcenters.com. My mom has hypothyroid. I'm pretty sure I do. Yeah, so here's what happens is a lot of people, this is Dr. Falcor, a lot of people do have hypothyroidism, especially if it runs in their family. And if it does, then you absolutely have to look into what's called Hashimoto's. Hashimoto's is an autoimmune condition that's causing the body to attack the thyroid. So you need to look into that. You need to see if you have Hashimoto's. Here's the markers you want to run. Write these down. Again, you guys need to have your notebooks out during these Q&As. You need to look at TSH, free and total T3, free and total T4, reverse T3, and then your TPO and your TG antibodies. And you need to be able to look at those and see. You can tell, do you have Hashimoto's? Are you underconverting? Is your pituitary off? So many different things, and we can see this all the time. Chrissy from West Virginia, good to see. I too suffer from thyroid disease and Graves and Hashimoto's. Yeah, so Chrissy, this is an autoimmune condition. It doesn't matter ultimately Graves or Hashis or MS like my mom had that she healed from. It doesn't matter. You have autoimmune. So now, Brittany, you want to give Chrissy some of my links to YouTube? I've got over 700 videos on YouTube explaining in depth how to get through that. Guys, here's the deal. This will be the easiest. Tonight at 7:30 Mountain Time, I'm going live on I'll be on TikTok. I've got a Zoom link if you guys want to get on Zoom as well. Just put down below. Brittany can put that link for the Zoom. And I'm going to be doing, it's probably 45, 50 minutes of actual teaching about thyroid. And then I'll be doing a Q&A. I'll be going in depth into each one of you guys' markers and what you have going on and ideas and giving suggestions, all types of different things. So jump on tonight, 7:30 Mountain Time. And I'm going to be getting in depth into how you need to fix those things. Let's go here. Sun3 Pearl, thanks for the rose. So yeah, and if you guys are getting anything out of this, make sure you give us some likes, some hearts. That always does well for our page. Yes, I've noticed when I eat, I feel better. Holly, it is probably that random anxiety. It's probably from that blood sugar. If you can get a finger prick glucose monitor, I don't know what you can get in England there, in the United Kingdom, but if you can get a finger prick glucose monitor, you've got to start seeing why that blood sugar is crashing down and what you need to do differently. Let's go here again. Go ahead and pop questions down below, guys. I will do my best to get through all of these. Are you a doctor? Yes, yes, I am a doctor. We practice what's called functional medicine. And so I've been doing this for over 20 years. All of my F8 doctors, we have over 100 years experience with everybody, and we work in depth on getting to the root cause of why people are having the issues that they do. What can you do? This is Mississippi Queen 55. What can you do for rheumatoid arthritis? Rheumatoid arthritis, it's an autoimmune condition. So same thought process. You could ask me this about lupus. You could ask me this about scleroderma. You could ask me this about alopecia, where people's hair's falling out, about MS. It doesn't matter. It's the same thought process. It's not about getting a drug. It's not about getting a surgery. It's not about suppressing your immune system. It's about helping to combat why the body is revved up, why the body is attacking itself. And so what we look at, again, I'm going to be talking about this tonight on the live Hashimoto's thyroid seminar. I'm going to be going into, okay, what do you do for the adrenal glands? How do you help the adrenals stabilize? What do you do for blood sugar? Because every time blood sugar goes over 85 or goes below 85 or over 110, again, write this down. You should have your notebook out. Every live Q&A that I do, write down all of these tidbits. 85 to 110 every time it goes up. Every time it goes down, you rev it up and attack the immune system. Your vitamin D, you need your vitamin D upwards of 80. You've got to have that. It modulates the immune system. So you've got to have your vitamin D where you need to be. You've got to look into food allergens and any potential foods that could be contributing to this. And you need to look into any infections. Are you dealing with any chronic H. pylori like we've talked about, any Epstein-Barr virus, any of these different infections can drive that. So there's so many different stimulants. Brick, if you want to put a link down there for our YouTube channel, I've got tons of videos on autoimmune. You guys can dig deeper into there. My doctor refuses to treat me for ulcers. Hi, YouTube 22. So yeah, if your doctor refuses to help you, click the link down below, schedule that discovery call. Let's talk about this. We can work on killing off that H. pylori. We can work on healing up that gut lining. We can work on getting the good bacteria back where it needs to be. So many things. Connie, is it necessary to get tested for COVID if I have symptoms, and if positive, should I call my internist? Not sure, Connie, why you would call your internist if you have a positive. I guess it depends what else you have going on. That's a personal decision whether you get tested or not. If you're sick, you should probably stay home and not be around people in the first place. Don't go sneezing on people. Don't go coughing on people. But I guess, for me, if I'm going to test anything, if I'm going to go to the trouble of testing something, is it going to change the outcome of my treatment? What am I going to do differently for somebody? And so if you're going to do something different, then okay. But if not, then I wouldn't worry about it. I would just take care of yourself and go from there. Let's see here. And I've had the same experience regarding doctor not wanting me to come off of medication, but I'm going to be doing it myself. Yeah, just be careful. Make sure you guys are paying attention to everything. Allison Fasano, I have been having internal tremors and anxiety and depression. Any suggestion for what to look at? So internal tremors and anxiety, it could be a hyperthyroid state. So your thyroid could be too revved up. So you want to check your TSH, your T3, and your T4. I would also check your Hashimoto's markers, your TPO and your thyroglobulin, see if there's a autoimmune going on there, because if you're attacking your thyroid and it's spilling out into the bloodstream, that could definitely have too much T3, T4. It could get revved up that way. You want to look at your blood sugar because, again, if you're having anxiety like that, that blood sugar, when it crashes down, the adrenals kick in. It tells the liver to release glucose, but then you've got adrenaline going through you. So if you're having random anxiety, write this down. Random anxiety, you've got to start checking your blood sugar. Do finger prick glucose monitor, or like every one of our patients, get a continuous glucose monitor and start figuring out why that blood sugar is going up and why it is going down. Just out of remission with gastroparesis, suggestions to calm it down, please. Yeah, so this is YA Tilly. Gastroparesis, horrible, guys. Think about this. What if you were throwing up every single day? And that's just your life. You throw up every single day. That's what happens with gastroparesis. We've had so many patients we've helped with gastroparesis, get them to calm down. They don't throw up anymore as long as they do what they need to do. So here's some things that you can do to calm down. Look into food allergies, gluten, corn, soy, dairy, even possibly some nuts and seeds or beans, or some go anti-inflammatory diet as much as possible. I would look into the vagus nerve. You might even need to do some coffee retention enemas. You can Google that. We'll talk about it later. A lot of people don't like to think about it, but it's very, very helpful for gastroparesis. We'll probably need to do some kill off. So oil of oregano is one of the best ones to do, and then some probiotics afterwards. So if you're dealing with gastroparesis, if you're throwing up every day, you absolutely can get help. You can get better. And hey, Tori, thank you for gifting. Appreciate that. The roses. How do you start fixing your immune response? This is Miss Elbeck. So I guess depends on what we're talking about when we say fixing the immune response. Two things that can go wrong with the immune response. One, it can be way too high, and that can be autoimmune, and it's attacking its own tissue. Number two, it can be way too low, and you can be getting infections all the time, sinus infections, bronchitis, all types of different things. So which is it? Which is really the big thing that we're looking at? Is it going to be more of that you're getting this decreased immune response or this increased immune response? So what do you need to do to fix it? Well, one of the easy ones to do is vitamin D. Get your vitamin D at a good level, and that modulates the immune response. So it helps turn up at the right time and turn down at the right time. Vitamin D, really closer to 80 if you've got an autoimmune condition. And if you're having a hard time getting your vitamin D up, you need to take some orally, get outside 11 to 1, but especially this time of year, depending on where you live, you may need to get into a tanning bed even once or twice a week for 10-15 minutes would be enough. Or you can actually get home tanning bed places. Deborah, do you have a specific protocol for Lyme disease and co-infections? Is there a discussion I could watch on this? Yes, Deborah, I have done some on YouTube. You can check those out. But Lyme disease, it's a slippery slope. Co-infections, everybody's unique in there. Ultimately, yes, that there are protocols you can do, and you can do kill off and this and that. But ultimately, your body is a lot better protocol killer offer than any supplement, any antibiotic, whatever it is. So first thing is you've got to build your body up as strong as feasibly possible, Deborah, to be able to deal with the Lyme disease, to be able to deal with these co-infections, all of these different things. So you absolutely need to do that. So again, anybody jumping on that is new here, Dr. Ben Gaillard, follow our page. We're on Facebook, we're on TikTok, we're on Instagram, we're on YouTube. Go live all the time. We've got lots of information, tons of videos. Love helping people. We have offices in Colorado, offices in Tennessee, and then we work remotely with patients all over. Key part of it is getting the blood work done. You've got to get in depth into what is going on. Okay, here we go. So Aunt B28, is Hashimoto's always cancer? I'm only 30. I don't want to die yet. Okay, here we go. Great news. Hashimoto's is not cancer. It's never cancer. Those are two different things. Somebody could have thyroid cancer and have Hashimoto's, but they are two totally different things. Hashimoto's is an autoimmune disease. I'm going to be going in depth into it tonight at B28. Jump on tonight, 7:30 Mountain Time. Jump back onto TikTok there. And I'll be going in depth into what Hashimoto's is, how to fix it, what to do. So think about this. Hashimoto's is autoimmune. It means your immune system is attacking the thyroid or the bus that transports the thyroid hormones around, and you are not going to die from Hashimoto's. Thyroid cancer is a totally different thing. Good news, most people don't die from thyroid cancer anyways. You probably have to have your thyroid removed, but that's going to be it. So do not stress about dying if you have Hashimoto's. You need to take care of it. You need to calm down that immune response, because it's very likely if you do have Hashimoto's, you probably have other autoimmune conditions as well. Allison, link for the Zoom. Yep, Brittany, can you get that for Allison, please? And can pituitary cause sleep problems? Susan, potentially, but think about what the pituitary does. The pituitary sits right up here. It kicks out TSH, thyroid stimulating hormone. It kicks out ACTH, the basically adrenal stimulating hormone. And then it kicks out FSH and LH, which is going to be giving stimulus and feedback loops for estrogen, progesterone, female cycles in there. So pituitary isn't necessarily going to cause the sleep problems, but the adrenals definitely can be causing sleep problems. If the pituitary is fatigued, if it's run down because you're chronically stressed, then it may not be stimulating like it's supposed to. So that whole endocrine system, we call that kind of triad there of adrenals, pituitary, thyroid, that absolutely can affect your sleep. So you've got to get those adrenals balanced out. Hey, Stacy, I had a super sore back for 3 days and felt tired at the beginning of December, and I'm still dragging my butt. How do I tell if there's some reactivated virus at work? How would I get my energy back? Yeah, Stace. So very good likelihood that if you were kind of achy and were run down and now you're still dragging, I would run blood work, look at your CBC, look at white blood cell count, see if it's below 5. And then if your lymphocytes are over 38%, very good chance that you have some type of a viral infection going on. So then we can go through and work on helping that body to fight it off, get it down. Yes, there's certain things you can do, vitamin A, NAC, you can do any type of antiviral, natural antivirals, get your vitamin D up where it needs to be, but ultimately you've got to build your body back up stronger. Your blood sugar, your leaky gut, your adrenals, all those things need to get in better shape. What foods are allowed when healing the gut? Jacqueline Turner, so if we're doing leaky gut support, it's almost like an autoimmune paleo type of a diet. So what foods are allowed? You can do animal proteins, you can do vegetables, you can do good quality fats, a few fruits like berries that aren't going to raise your blood sugar, and you can do broth, you can do coconut milk, coconut oil, you can do some of the collagen powder, some of those things, and then nutrients like aloe vera, marshmallow root, glutamine, things like that. Those are going to be some of the best to help that gut heal. And I'm on metformin and Ozempic. Is that dangerous? That's interesting. Canary Girl 13. That is really interesting. Both metformin and Ozempic are diabetes drugs. If you have diabetes, then they're not fixing why you have diabetes. Why you have diabetes is that blood sugar is going up too high, and you need to look at what foods, what drinks are making that happen. What you need to be doing is a continuous glucose monitor. And if you've got that continuous glucose monitor, then you're going to be able to see, hey, I just went up to 130. What did I eat? I better not eat that again. I'm going to keep that blood sugar stabilized. So you can do that. That's what we do with our patients every single day, is keep keep that blood sugar steady, 85 to 110. They learn exactly how you do that. So I mean that's going to be really pushing that blood sugar low and ultimately not fixing anything, because if you stop metformin, if you stop Ozempic, then you're going to have issues come right back. Angel Kisses for you. How do you feel about Tamiflu? Is this if somebody gets the flu and then they go take the drug? What I would rather do, there's things that naturally you can do. I'll do a vitamin D boost with patients where they do 50,000 IU a day for 3 days. Again, write these things down. Do not miswrite and do like 3 times a day, like I've had some patients do. 50,000 a day for 3 days. I'm not telling you to do that, but this is what we do with patients. You can do a bunch of NAC, natural antivirals, things like that. But more importantly, get your body as strong as possible before getting the flu, before getting exposed to the flu. You need to put your body in the best state possible to be able to handle these things. So again, welcome everybody. Anybody new jumping on, Dr. Ben Galliard, click down below. You can check out all of our information, website, other social media platforms, our well store where we've got a bunch of supplements that we use with our patients. You can also schedule a discovery call where we'll sit down and talk to you about exactly what you have going on. And Deborah, you've got Lyme and Epstein-Barr. Yep, those go hand in hand a lot of times. Hi from Canada, and thank you for all you do. You betcha. How are things in Canada? You guys pretty cold up there? Susan with fibromyalgia and insomnia. I can't sleep. Susan, you probably need a brain map. What do you do for vagus nerve, Deborah? One of my favorite things to do is to have people do a coffee retention enema. Do the coffee enema and retain it. This is going to be the best thing to stimulate that vagus nerve. It stimulates those nicotinic receptors, which drives that vagus nerve. Hold it, hold it, hold it, hold it, and then when you finally have to go, then you go. So that's a big part of what we're looking at is can we stimulate that vagus nerve? Gag, gargle, hum helps, but I just haven't seen it be a massive changer. So again, put your questions down below. I'm going to try to get through as many as I can. If I don't get to your question, send me a direct email, drben at f8wellcenters.com, DRBEN, and I would love to answer that. Sundays, Emma, ouch, hemorrhoids, I know that too well. Yeah, look at your adrenals, and then thank you, PCOS and endometriosis. PCOS, insulin resistance. You've got to get your blood sugar stabilized. Liver detoxification, you've got to make sure you're clearing out your hormones as well. So get that blood sugar as stabilized, 85 to 110 as possible. Use a continuous glucose monitor. Use finger prick glucose monitor. We've got them on our well store. You can get my book and read about how to exactly do that as well. But let's see. Hazel, my 17-year-old son makes this it's almost like a grunting noise trying to clear his chest, but he doesn't have a cold. Any ideas why he's doing this? He's also been coughing on and off for a year. First thing I would look at, Hazel, let's just take out some food allergens. You know, if you don't want to go down the whole path of working leaky gut and doing detoxes and all those things, just take out food allergens. Gluten, corn, soy, dairy. Start there, take those out, and it sounds like he's got a phlegm. Even just gluten and dairy, even if you don't have an allergy to them, they are more mucus producing foods. So I would take those out and see what happens. Kahin DeRose. So Google says I have cancer, so I'm scared to go to the doctor. So, you know, here's the deal. If you give me a thumbs up, give me a heart if you guys have ever done this, if you've Googled symptoms or looked up symptoms online, and then cancer was one of the things that came back, right? That happens for everybody. And so Don't just go off of, oh my gosh, I've got cancer. Yes, if you're having some major symptoms, you need to get checked out. You need to have some blood work done. If you've got some weird symptom, and it really is a cancer based, but you need to get checked out. But not every symptom is cancer, so don't go too extreme there. And I have the flu and feel terrible 4 weeks now. What do you recommend for chest congestion? Do you have a nebulizer? Angel Kisses for you. I would look into nebulizing, and there's different things that can be helpful, but look at a nebulizer. Allison loves Jesus. Jesus loves you. Amen. Can starting T3, T4 compound add to hair loss? It shouldn't. So think about this. Most people, if it truly is hair loss because of low thyroid, starting some T3 and T4 hormones should help that. But if hair loss continues or gets worse, there's probably other things contributing to it. It's not just the thyroid that's contributing to that. So you've got to do this in-depth blood panel. This is what we do with patients every single day. We look at all their hormones and their adrenals, and we look for Hashimoto's and inflammatory markers and autoimmune markers and all types of different things. So you might even have alopecia, which is an autoimmune thyroid condition. Dawn, I had a cold that took my voice. It's been 2 months and has been, the cold's been gone, but voice sounds terrible. So if you have that irritation, congestion, phlegm dripping down, you may want to look into, just like I said, pulling some of those foods out, pulling out some of those inflammatory foods, some of those potential allergens, and just see if you can get that down. What's your view on liquid collagen? Liquid collagen can be great. Is it the be all and end all? Is it going to make your hair grow and your nails be perfect and your skin be perfect? Not necessarily. And kind of a lot of people have jumped into that bandwagon and are making it. And so I don't know about the quality of all the different collagens out there. I use a lot of Ancient Nutrition for their collagen and their bone broth. I know Dr. Axe personally, and the quality that goes into their products. So that's what we use a lot with our patients. But yeah, it's going to be a nice place to go. It's not going to fix anything, but it's going to be a nice adjunct. Almost every morning I feel sick, stomach burning, and coffee makes it worse. Okay, this is Christy. So again, we were talking about H. pylori earlier. We were talking about ulcers. Try this. Take a shot, 2 tablespoons of apple cider vinegar. So take that on an empty stomach and see what happens. If you've got lots of burning, if it's uncomfortable, you probably have ulcers and you need support, especially from a place like FA. So take that shot of apple cider vinegar. Everybody do this. Write this down in your notebook that you're taking notes on. Take a shot of apple cider vinegar. If it feels fine, don't worry about it. If it burns in your stomach, you probably have an ulcer. Click the link, schedule that discovery call, and let's get you fixed up. Hair loss, is it really PCOS? Well, Joey Clark, the main thing with looking at this would be looking at your hormones, because if you have this high testosterone and if you have this high DHEA, then yes, it could be contributing to hair loss, and you can be getting male pattern baldness. So some women start getting male pattern baldness. They start getting chin hair and male pattern baldness when they are getting this PCOS, which PCOS is usually this increased testosterone, increased DHEA, and then they get cysts on their ovaries, etc. But remember, if you do have PCOS, if your testosterone's high, insulin is high, you have to get rid of that insulin resistance. You have to stabilize it. Paper Princess 97, I have Hashimoto's. Jump on tonight, 7:30 Mountain Time, live on TikTok. We're going to also be on a Zoom, so if you want the link for the Zoom, you can jump into that group and that chat group as well. We've got links down below, but I will be going in-depth, spending probably 45-50 minutes on what thyroid issues are, Hashimoto's, what to do, what we do with our patients, and then a live Q&A specifically on that. Jacques Vaughn, how do you balance hormones naturally? So first you've got to figure out which hormones are out of balance. Are we talking about testosterone? Are we talking about estrogen or progesterone or adrenal hormones or thyroid hormones? What hormones are we talking about? Let's just go with testosterone. You've got to figure out why your testosterone is low in the first place. So if your testosterone is low, it's usually a DHEA deficiency. DHEA is an adrenal hormone, and it usually goes low when we're trying to make more cortisol. Cortisol is an adrenaline kind of a hormone. So if you're in this chronic fight or flight, you're going to be stealing away your DHEA, and you're not going to be making testosterone. So how do you balance them naturally? You figure out what the underlying cause is. And then you can start moving your feet. You don't do it by slathering on natural testosterone, or taking a pellet or a pill or whatever it is. That's not going to fix it. Just like estrogen, just like progesterone. Sure, you might need those short term, but long term, it is not going to be beneficial. Cheryl, can you explain why eating protein and carbs together is bad? Yeah, Cheryl. Some of you guys may have seen my Facebook post today, and we were just talking about this earlier. So for some people, if they have great digestion, they make plenty of stomach acid, everything's fine that way, it may not be that big of a deal. But for most people, they do not make enough stomach acid. And so as they are eating proteins and carbs, both of those digest at different pH levels. So pH is the acidity level, and protein is going to be more acidic digestion. Carbs and starches are going to be less acidic. So if you put them both together, neither one digests as well as they should. It's going to sit in the stomach for too long. It's going to percolate, start pushing up on the sphincter, and cause more issues. So we've got to, if you've got reflux, indigestion, heartburn, any of these things, keep those proteins and starches separate, and that's going to make a huge improvement. Tia, my doctor tested for ANA and it came back negative. Does my doctor need to continue testing for this every year? No, here's the deal, Tia. Did you ever have an ANA positive? If you did, then there's a very good chance that your body could be more inclined to create an autoimmune reaction. If it's never been positive, then, do they need to keep testing it? Guess what? Every one of our blood tests, we check ANA. Yesterday, I found 2 people, we checked rheumatoid factor, which tells about rheumatoid arthritis. I found 2 people that were high in their rheumatoid factor, in their C-reactive protein, that inflammatory marker that goes hand in hand with it, and they had no idea that they were even dealing with rheumatoid arthritis. Their joints weren't that bad yet. So we're catching it kind of like pre-rheumatoid area. So should you test it every year? Sure. I love checking ANA and seeing and catching before somebody has a full autoimmune condition. So, and how long should you wait to drink after a meal? Grace, so I like at least 30 minutes to wait to drink after a meal. So remember, guys, if you're having digestion issues, you want to not drink fluids with your meals. So hold off on drinking fluids with your meals and give your body a chance to produce enough stomach acid and break that down. So I like at least 30 minutes on there. So again, we've got hundreds of questions on here. I'm going to try to get through everybody, but probably not. So if I don't get to yours, put it down below. Again, also tonight, 7:30 Mountain Time, I'm going to be going live on TikTok as well as Zoom. If you guys don't have access to those, click down below and Brittany will get you on there. And we will be going over exactly what's going on with thyroid. Bring your numbers. So this is the important part. If you're getting on tonight, bring your numbers, print out your blood work, whatever you need, because I'm going to be going through each one of those and you're going to be able to compare and see exactly why you're having thyroid issues. Jelly Slug, do you think birth control affects thyroid issues? Yeah, I think birth control, get this is the most important thing. If you've been on birth control, this is the most important thing you can get today. Birth control is not hormone suppression. Birth control is hormone replacement. that is going up so much that it suppresses the body from doing its natural rhythm. So birth control is not hormone suppression. So having excess female hormones in your body, can that affect thyroid issues? Absolutely. Estrogenic events, especially if you have Hashimoto's, one of the things I'm going to be talking about tonight is estrogenic events. And one of the things I'm going to say is going on birth control is an estrogenic event, and that can drive Hashimoto's. So if you have Hashimoto's and you're on birth control, then absolutely that can be driving your autoimmune. Kim, Hashimoto's, fibromyalgia, rheumatoid arthritis, lupus. Yeah, not much fun, Kim. But jump on tonight. I'll be going in depth how we help people with autoimmune, especially Hashimoto's, and same thought process. You're in this immune inflammatory cycle. You've got to calm it down. We check for ANA on every patient. We check for rheumatoid arthritis on every patient. We check for Hashimoto's on every patient. And so often we see it, and it's this immune inflammatory cascade. You're dealing with adrenals and blood sugar and leaky gut and vitamin D deficiency and all of these different things. So let's go here. Okay, my neutrophil count dropped by 3. I Googled this. It says I'm linked to cancer. Is this true? There's tons of things that can make the neutrophils go up or down. So I would not jump into. Thank you. What does it mean when your ANA is negative? All that means is that right now, in that moment when you test blood work, that your ANA is not positive and you're not testing for lupus, Sjogren's, mixed connective tissue. Do you know much about PCOS? Yeah, Julie, we were just talking about this. PCOS, huge. Again, for those just jumping on, put down any questions you have, put down where you're watching from. Love to see you guys. So PCOS, polycystic ovarian syndrome, this is driven by insulin resistance, metabolic syndrome, blood sugar issues. You've got to stabilize the blood sugar. That's why they put women on metformin, all these different diabetes drugs. But even I've seen 110-pound females get put on a diabetes drug for PCOS, but they don't fix the why. So what you need to do, you need to start monitoring your blood sugar, finger prick or continuous glucose monitor. This is what we do with patients every single day. You've got to figure it out. Can having high levels of cortisol mimic anxiety attack symptoms, high heart rate? Absolutely. I like cortisol 8 to 12 in the blood work. If you're up at 17, 19, 21, whatever, that's going to be adrenaline basically flowing through your body. So think about if you're driving down the interstate and all of a sudden you see a cop sitting behind a sign or something, your heart rate goes up, all this, you get this adrenaline going through. That's what it's going to feel like to have high cortisol all the time. It's pretty intense. What is the success rate? Letrozole on ovulation with PCOS. I don't know that answer, Sabatha, but what I would tell you is that if you have PCOS, there's no amount of drugs that are going to fix you. No amount of metformin or Ozempic or whatever they're going to put somebody on for that PCOS. You have the ability inside of you to recover from PCOS. You can stabilize your blood sugar. You can work on your liver, detoxify, get rid of the excess hormones, all these different things. It's totally possible. We see patients all the time. Does a positive ANA of 1 to 1280 always mean autoimmune? Yeah, Spirit Girl 88, I would say 99.999% of the time, and that's a really high one. ANA, if it's 1 to 40 ratio, it'll show up negative. 1 to 80 is positive, but then you've got 80, 160, 320, 640, and then the 1280. So that is a really, really high number. You are having tissue damage. Not sure where, but you are having tissue damage, guarantee at this point. My daughter has a positive ANA, speckled. What does that mean? Foster dog mom. She has autoimmune. That we're not sure where, we're not sure if it's lupus or Sjogren's or what's going on, but she is attacking tissue and she has an autoimmune condition. So now you've got to make that whole shift and go, okay, how do we calm this down? Because what is stimulating that autoimmune is the most important thing you can think about. So again, looking at adrenals and blood sugar and leaky gut and liver and all these things, in the traditional medical model, they'll try to squash it. They'll put you on prednisone, they'll put you on methotrexate, which is low-dose chemo, put you on Humira, $10,000 a month, all these things, but none of that fixes the why. None of that fixes the why, and that's what we do at FA. What do you do about estrogen dominance, Tammy? Make sure that your liver is clearing out the estrogen like it needs to. That's called phase 1 and phase 2 detoxification. And so you've got to look into liver cleanse, liver support, just doing as much as you can to clear that out. And then also make sure you're not bringing in too much estrogen from plastics and all types of different things. So Stacy, it was negative 27 with the wind chill for Christmas, but it's been over 0 for a week now. That is in Celsius. Stacy is in Canada, so negative 27 in Fahrenheit. I'm not even sure what that is. Probably negative 50, 60, 70, something like that. Pretty crazy. Okay, let's see what else we've got here. How can you tell if acid reflux is from low or too much acid? Nayri, Navy. So most people, 98% of people, are going to have too little stomach acid. As we age and as we're under stress, anybody doing that, give me some thumbs up or some hearts. If you're aging or you're stressing, we're going to actually not make enough stomach acid. So if your stomach acid is too low, which the vast majority of people are, the food's going to sit there too long and it's going to start to regurgitate and push up on that valve, and that's when we get the reflux. So again, try these 3 things that we were talking about earlier. Chew 30 times every bite, no fluids with your meals, and then properly combine your foods, keeping your proteins and carbs separate. If you do those things for a week, it's not better, I'll send you my book free. So try those out. But ultimately, if you take apple cider vinegar or some supplement with betaine hydrochloride, Brittany, if you want to put a link for stomach support from the WellStore in there, and it helps you digest better, that's going to be better. What DHEA should women take? So Foster Dog Mom, on our WellStore, Brittany, if you want to put the DHEA that we use with our patients, it's a liquid form. I really, really like it. But I wouldn't suggest people just go randomly take DHEA. We always start with working on their blood sugar, working on their liver, making sure they're detoxifying like they need to, a bunch of different things. And then if you've had any cancer concerns, anything like that in the past, especially estrogen-based cancers, you should not take DHEA. Tips to restore stomach after H. pylori eradication therapy, Virginia. So aloe vera juice is great, glutamine is great, zinc carnosine is really, really good. Brittany, if you want to put down the link for the WellStore and the intestinal repair SE, that's got the zinc carnosine and the glutamine in there, and I would do a couple scoops of that a day, and that would be really, really good at helping to heal that up. Protein and veggies okay though, or is that carbs? Yes, Joey, protein and veggies are going to be great, just not sweet potatoes, squashes, things like that. But yeah, that is going to be great. And can your blood work come out normal 1 month and not the other with PCOS? So experience the world with me. So here's the deal with PCOS. Usually, the things we're looking for, the DHEA and the testosterone, are going to be the telltale signs with PCOS. So if those are, thanks for all the hearts, guys. If those are going to be normal 1 month and then not the next, I would say, how big of a change is it? There will be some fluctuation, but I wouldn't guess that it's going to be moving that much. Let's go here. What about hormonal replacement therapy for menopause? Here's the deal. Wendy, thanks for the rose. Appreciate that. So hormonal replacement therapy for menopause, where should our hormones be coming after our ovaries stop producing them, or uterus, maybe you get a hysterectomy, whatever it is, they should be replaced by the adrenals. And if you're already in adrenal fatigue, if your adrenals aren't working as well, then you definitely need to put some work and energy into the adrenals and get that going again. So, or if you're going into menopause, work on your adrenals. Number one stressor to the adrenals, blood sugar swings, especially the blood sugar dips. Make sure that blood sugar is as stable as possible. So you've got to keep that nice and steady in there. Let's go over here, see what else we've got. Deborah, can I purchase your books? Yeah, Deborah, if you just go on to Amazon, Britt, if you want to put those on there, we've got 2 books, Rebuild Your Brain, Stop the Damage, Start the Repair, and Blood Sugar Doesn't Lie. You can look at both of those. And yeah, just on Amazon, we keep them pretty cheap on there as well. And can ulcers be caused by something other than H. pylori? Sure. You know, we can get ulcers just from, if you're taking a bunch of aspirin. Every time you take 1 aspirin, you lose a cc of blood. Other NSAIDs, ibuprofen, Tylenol, things like that. If you've been on a lot of antibiotics, if you're under chronic stress, yes, other things can cause it besides H. pylori. Love my Ancient Nutrition collagen. Yeah, Dr. Axe, he's the man. We've been buds for a long time. Mrs. C. Benson, 94. Apple cider vinegar, that would burn all the way down and it would hurt me badly. Yeah, so you're probably pretty irritated in that digestive tract, possibly even some ulcers, things like that. Jacqueline, how much is an appointment? So the discovery call is free. Just click that link down below, schedule that discovery call, and know any good functional medicine doctors in Calgary. US dollar a lot to ours. Joey, here's the deal. It's going to be really hard for functional medicine doctors to practice in Canada. You guys are so regulated. You know, you can't even really get supplements. They can't sell supplements. Hard to run blood work. I mean, I don't know any in Canada. So yeah, sorry about that. Do foods that spike blood sugar affect each individual differently? Yeah, Panda may. We have run glucose monitors. I'm way ahead of the curve. You've probably seen some of these things on social media and stuff about the continuous glucose monitor. We've been finger prick glucose monitoring for 10 years. We've been doing the continuous glucose monitor for about 4 years now. We've run thousands and thousands of people on it, and it absolutely can affect people differently. Some people do great with one thing and their spouse does absolutely opposite. They say sweet potato is better than white potato, but for a lot of people with blood sugar, it's actually worse. So totally different and unique and individualized. So Panda May, you've got to get out a glucose monitor and start checking it yourself. Absolutely. Okay, let's see what else we got here, and then I'm gonna have to jump. My husband has restless leg and they want to take a pint of blood out. Would that help his restless leg? Twyla Casey, I'm not sure about that one. We're like going back into the dark ages where they're draining people. You know, it's probably because he has a high ferritin. Ferritin high is about blood sugar. It's about insulin resistance. It's about the fatty liver, triglycerides, inflammation, all types of different things. So look into that blood sugar first. Look into reversing his prediabetes, diabetes, whatever it is, and that restless leg will probably go down. What are your thoughts on Ozempic for weight loss? It does nothing to fix it. So if you do everything the same, take Ozempic, lose weight, stop taking Ozempic, you're going to go right back to where you were. So you've got to, all Ozempic does is lower your blood sugar. So a lot of people already have hypoglycemia. They're already going low blood sugar sometimes anyways. It just keeps them from going as high, but then you're crashing down even more. So it's not fixing anything. So here's the deal, guys. I got to jump. Thank you so much. I got to go see some patients. FA Well Centers, we are here to help you guys get your life back. 2023, health is really, it's becoming more and more prevalent for people that they realize if they don't have their health, they don't have anything. So I'm here to help you. My entire FA team is here to help you. We've got offices in Colorado, offices in Tennessee, and we can work remotely with anybody, even up in Canada. And we can get blood work done anywhere in the United States, anywhere up in Canada, and we can go through step by step getting you your life back, whether it's an autoimmune condition, whether it's like tonight, I'm going to be talking about thyroid, whether it's thyroid, whether we're dealing with any type of digestion, brain issue, anything at all, reach out. We're here to help you guys. Schedule that discovery call. That's the first thing to do. Schedule that discovery call. One of my team will sit down with you, talk about what you have going on, give you guys love, give you guys support, and see if it's a good fit. And if you have not already followed our pages, whether that's Facebook, YouTube, TikTok, Instagram, whatever it is, follow us. Tons of information. My passion, my goal in life is to change the face of healthcare so that people get to the true underlying cause. Don't just have to settle for a drug. Don't just have to settle for a surgery, but truly let their body from the inside out heal and not be this chronic depleted state. So love you guys. If you need specific questions, send us a DM or send me an email, drben@f8willcenters.com. Love y'all. You just have a wonderful day and stay strong out there, okay?